Bita Vesna, wife of the Governor of Katsina State, has joined the world to celebrate Cancer Day, the day set aside by the United Nations to educate, enlighten and seek support for cancer patients. TVC News correspondent Abdulatif Yusuf reports.
Cancer is one of the second cause of deaths globally and one of the health conditions that is prevalent in developing countries like Nigeria. The lack of funding for cancer care and palliative care services as part of universal health coverage are among the factors considered to be responsible for the number of deaths. The theme for this year is Close the Care Gap. The State Commissioner of Health is part of this renewed effort and speaks more on the need to fight cancer with more seriousness.
All people, regardless of their circumstances, have access to information, resources, and support they need to prevent cancer, detect it early, and receive the best possible care. Let us use this day to amplify our voices, to inspire hope, and to encourage positive change.
Taking the campaign to schools and other institutions is seen as another way to enlighten adolescent girls early enough on growing cases of breast and cervical cancers.
So the partnership with the Ministry for Basic and Secondary Education and of course the Agile project is not a coincidence. It's also not by accident. It's all part of the plan of the ministry to ensure partnering with each and every stakeholder to ensure that especially children are living happily, not only in school, not only at home, but in their communities.
The convener of the 2024 celebrations of the World Cancer Day and wife of Katsina State Governor Zuleyhatu Korada explains the new initiative headed by her foundation to assist cancer survivors.
This year World Cancer Day celebration and awareness is a very unique one, taking into consideration the theme, Close the Care Gap, added to the candid commitment that all the Nigerian governors' spouses are championing the fight against cancer across the 36 states and Abuja. As we reflect on the impact of cancer, let us also celebrate the progress we have made in research, treatment, and patient care.
Other goodwill messages at the event provided insight on ways to prevent the growing scourge and call for more commitment from the government. Recent research has identified lung cancer as the most commonly diagnosed type of cancer worldwide. Abdulatif Yusuf, TVC News, Katsina.
Well, we have consultant, radiation and clinical oncologist, NSIA Luth Cancer Center, Dr. Bolanle Adigboyega, joins us on TVC News at 10. It's good to have you join us on the news. The World Health Organization, of course, released troubling statistics about cancer, saying that the number of new cancer cases globally will reach 35 million by 2050. What are the factors driving these numbers?
Oh, thank you. Good evening. Thank you for having me. So generally, there's a change in so many things, our diet, our way of life. Then people are not screening early. There's no access to care. And in Nigeria, some of us, we believe in myth and misconceptions about cancer, thinking it's an arrow, it's an evil arrow, it's an attack, so people don't even present early. So these, among many factors, are responsible for the numbers growing higher.
But if you take a look at the 3-year-long campaign that commenced in 2022 and will end this year, I'm talking about the Close the Care Gap. Everyone deserves access to the cancer care campaign. Where do you think we are now? Have we made appreciable progress?
Well, generally, I think we're getting better. We're not what we used to be, but there's still a long way to go. For instance, in Close the Care Gap, it has to do with both the patient, with the relatives, the community, the environment, and the caregiver, and the access that we have to cancer care. So before now, there was a time that there was even no single working radiotherapy machine in the whole country. But for now, we have a number of functional centers, though it's still far less to what we're supposed to have. And then at least we have access to these latest advances in cancer treatment. only that it is not affordable and it's far below what it used to be. Before, we don't even get patients that present early, but now we have patients that are coming in following cancer screening. So we are getting stage 1 cancer, we are getting stage 2, that we know that can still be cured if funds is not an issue. So we are moving closer, awareness is increasing, but the access and the affordability is a major one we are having now.
Of course, just like a majority of countries do not adequately finance priority cancer and palliative care services as part of universal health coverage, but what immediate solutions would you suggest to Nigeria's Minister of Health?
Okay, in the immediate, so I think now we have launched the cervical cancer campaign, though the uptake is a bit slow, but I think maybe we have to create more awareness such that cervical cancer is a cancer that is highly preventable. So if that is out of the way, then it's actually going to bring down the body. So now the major one will be the financing. So now health insurance, NHIS is taking, but most NHIS is not even covering cancer. Fine, the government is doing some cap initiative program so that some patients can afford cancer chemotherapy, but we need it to cover stuff like radiotherapy. We need more money into that. Then financial toxicity is a major problem with cancer. So government and NGO and individuals have to put in more funds into it. Now, in some cancers, you can even achieve cure with some targeted therapy, immunotherapy, but it's far beyond the reach of an average Nigerian. Even an average Nigerian still cannot afford because it comes in millions of naira. So more funds has to be dedicated into it. More health insurance has to include cancer care into their coverage. And with that, at least it will still solve some issues.
Hopefully that will bring down the numbers, of course, the troubling numbers being released by the World Health Organization. Consultant, radiation and clinical oncologist at Luth Cancer Center, Dr. Bolanle Adigboyega, thank you so much for speaking with us.
Thank you very much.